Recovery Ways is a comprehensive program that offers people a way out of despair. It tackles alcoholism, it tackles chemical dependency, prescription drug addiction, and many other addictions that in and of themselves we may not think of as serious illness, but it really is.
We created an environment that is very comfortable, warm, inviting, home-like environment that people can come and feel safe and secure as they start their process in their road to recovery.
It's an experience that's welcoming, it's warm, and it has an element of dignity to it. Recovery Ways treatment program has private rooms as an integral part of the facility where the program is offered. We believe that our clients coming in for treatment are probably better served if they have their own privacy after a hard day of treatment. We all know people that have problems with alcoholism, drug use, even opiates, prescription drug abuse. And yet our reactions as often as mine was to just not understand that it was a disease and maybe be angered at their behavior.
As a part of the clinical team, our job is really to help people feel safe, knowing that in that first week especially, they're going to still be on the fence sometimes about, am I really ready for this change? And so a lot of what we do is try to make them feel comfortable and get them in a place where they can start to see themselves and see that change is possible.
We treat people for who they are, not where they are. Where they are may be in a pretty bad situation based on some bad decisions, but who they are may be a fundamentally good person who's just made some bad decisions, who's gone inch by inch to a place they would never go to quickly.
It has the highest level of accreditation that's available in the United States today. We have been accredited by the Joint Commission as a facility that meets all the standards of that organization, standards that all hospitals have to meet.
So we really emphasize healthy diet. We have a dietitian that plans our meals, and then we have a chef that prepares them every day.
The whole concept of our approach to this was to build a stellar program directed by leading medical professionals, housed in a new environment, and offered at an affordable price. If you or someone you know suffers from the disease of chemical dependency, drug addiction, alcohol addiction, or some other addicting disorder, help is here.
We have community rooms that are very comfortable also, that families come on family day to visit with their loved ones that are staying in residence here. And there's also space that they can socialize, play games, and visit in the limited amount of free time that they have.
One of the things we know about substance abuse is, well, it creates its own host of problems and ways of doing things, and it creates a whole new world of how they cope and what they do and its own problems. It's really what we call a biopsychosocial problem, which means that it's really a symptom of something much bigger. The most important part of my job is helping them tell that story and helping them to see that their drug use came as a response to something else. And by understanding that initial event, it helps them to start to see themselves more as a person that was just trying to cope, and that they can actually overcome it and do something in a new way.
We have excellent therapists on staff here at Recovery Ways. They are very caring individuals and very trusting individuals, and they're able to reach inside the people that come here to their souls and get them to see their life for what it is and the ways that they get to make changes in their lives.
What we've tried to do at Recovery Ways is to try to offer the upper end of treatment as far as quality, atmosphere, environment, safety, etc., at a very moderate price.
We individualize treatment for everybody because everybody's story is different. Everyone comes to this place in life and on a different path. Nobody wakes up one day and is like, oh, I think I'm going to go become a drug addict today. You know, it takes time, and it takes breaking a breakdown in their ability to cope, a breakdown in the systems in their life to get to this place. And so we backtrack and really individualize what we do to help each person really come into what they need for themselves to stay sober and what they need to go out into the world and do what they want to do with their life. After they leave, we do the aftercare piece, which means they keep calling me. I have people who just text message me and say, hey, today's a great day, or hey, I'm struggling a little bit today. And we kind of monitor them consistently for at least 90 days, 6 months, a year. And since we work with people from all across the United States, it's important too that when they go back to their home community that we've made phone calls, we've helped them connect and know what they're going to do next.
One of the things that Recovery Ways has captured, and they've done it very successfully, is to be able to create the environment that is a family environment where people come in and you've got a group of people that are vested in the same outcome. And that is, they're looking to save their lives and to have a fulfilling life. This is about restoration. It is about recovery. It is about taking a person who has otherwise made some poor decisions and giving them the opportunity to have that life back that they once had, or that life that they would like to have that they've never had.
We realize that if you yourself are not in need of treatment, that you probably know someone. And we just want you to know that we are here to help, and we invite you to call us, and we'll be there for you.
We know somebody. And if that somebody can come through this program and leave this program with a new purpose in life, to become a productive citizen, to be a caring father, a loving mother, a child that parents have reclaimed, that is the purpose of Recovery Ways.